India has a population of 1.2 billion people, and you saw up to 500 patients for one oncologist, right? If you go to Delhi or Mumbai, you may have one oncologist for 150 or 200 patients. But go outside these cities, and you will have zero oncologists for or one oncologist for thousands of patients. So first of all, these countries have very few oncologists, but even within these countries, they have dramatic geographic variation. So then you look at radiation therapy. For IAEA recommends one radiotherapy machine for 250,000 people. Nigeria, it is a country of 180 million people. There's 9 radiation therapy machines and 30 radiation oncologists. Nepal, a country of 30 million people, has 2 radiation oncology machines outside the capital city. So out of 30 million people, 24 million people live, in fact, 28 million people live outside the capital city. And they have 2 radon machines. It just tells you the situation there, right? India has 1 machine per 2.1 million people. Now, if you think about all these countries, what is common is the cancers which are commonest: breast cancer, cervical cancer, head and neck cancer, lung cancer, colorectal cancer. All of them need radiation therapy. Yet they don't have radiation therapy available. So, question is, what can we do? So, as foundation, what have we done? So, our model is pyramid model. What we do is we try to partner with organizations, individuals, and governments to help train physicians, healthcare providers, to help set up programs. For example, in partnership with the University of Illinois and in partnership with the government of Nepal, we support the establishment of bone marrow transplant center. We sponsored training of these physicians. We sent this physician to Sri Lanka to learn clinical genetics, and we sponsored his 2 years of training. And as you see, these guys are smiling and happy, and they all have been successful in establishing a bone marrow transplant center that does everything, and now under the guidance of Dr. Rondelli. This was the first patient who was treated with stem cell transplant there almost two or 3 years ago. Another patient who will receive transplant. So in a country of 30 million people, there are no transplant centers. Now they have 1 transplant center in Kathmandu. And they are able to do transplant for $5,000. That costs almost $300,000 in Seattle. So the whole idea is to not only provide these services, but also to make it accessible, affordable. I mean, there will be no point having a transplant center that provides transplant for $300,000 in the country, where your average income is $400 in a month, right? We have partnered with, this is what I believe in. I think every single individual has to die someday, right? The day you are born, you know you're going to die. So the way clean air, clean water is basic human right. I think dignified and peaceful death should be basic human right. Is there any individual here who wants to die in pain? Any individual here who wants to see their family members or loved ones die in pain? So clearly this is a huge deal, but often neglected. So question is, what can we do? As you saw, morphine is very cheap. It costs 1 cent. 1 cent to produce 1 pill of morphine. Can you expect any cheaper drug? At a time when average drug cost, oncology drug cost is around $15,000 in a month? You can't. So even in low-income countries such as India, Nigeria, Nepal, or tons of Latin American countries, Eastern European countries, we can make morphine and a number of these the medications that can provide palliation available. So we have worked with the government of India in Madhya Pradesh state work with folks in Nepal to provide hospice and palliative care programs. So this has been one of our success stories in India. So we partner with government of Madhya Pradesh, which is a state of 73 million people, large state, had no hospice and palliative care program. So we had an agreement with the government in November 2016. We selected physicians and nurses, and they were provided training. Is Dr. Walker here? Dr. Walker, can you stand up, please? And Dr. Walker is one of our champions and hero, and he has trained Dr. Chandramouli in India, in Madhya Pradesh, who was brought here in Idaho, in Boise. And this physician went back to India and has established this palliative care program. We also sent 2 nurses to train 8 nurses there who are master trainers. And now, as we speak, they are training nurses and doctors from all other 50 districts in the state. So by the end of this year, we will have 51 hospice and palliative care program in the state. So this has been one of our major success stories. So this has been our model. So the master trainers were trained, and now they train other healthcare providers. These are some of the pictures. Dr. Walker, Dr. Chandramouli. In fact, this is our office in Bellingham. He also came to Bellingham. So I just checked today, before I came for presentation, we had 161 patients who have received palliative care until June of 2018. So similarly, we are now, we have established hospice and palliative care program in Janakpur, in the southern city in Nepal. And this the physician was trained, and he is providing care in patients' homes. This is exactly what our vision is. For example, this grandma is sick. She had terminal illness. She should not be suffering. Healthcare providers should be able to go to her home. I love her smile. She should be happy, comfortable, should be able to play with her grandkid. This is exactly what our vision is. Locally, what do? We do advocacy. So besides this annual cancer conference that we have been organizing here, we are looking to see what we can do right here in our home in terms of improving disparities in cancer care. So good news is we have made advances in technology. Bad news is many of our patients can't afford. As a matter of fact, many patients end up choosing bankruptcy or death because many of them can't afford drugs. They can't afford hospitalization. They can't afford PET scans. Isn't that a shame? The wealthiest country in the world. And these are the major issues that have not been addressed. So we organized this conference, SCHAT, Summit on National and Global Cancer Health Disparities. The last conference we had, it was in past April. We had some of the national leaders from all over the country. We had lawmakers. We had Congressman Adam Smith. We had CEOs and vice presidents of major pharmaceuticals and other industry. We had media people from Cairo 7 and Como News in Seattle. So we talked about various aspects of cancer disparities and ways to tackle it. And we also talked about certain uncomfortable topics that we don't talk about. For example, who is responsible for rising cost of care? Who is responsible for rising cost of care? So we decided to ask that question there. So we had a debate, and debate was not like roundtable debate that you see in many medical conferences. It was presidential style debate, moderated by 2 media people and 1 physician. podiums, and all the debate panelists would be standing, and they would be asked questions. And panelists would have no idea what questions would be asked. So this year we have similar debate. And the debate is it time to make FDA great again? Debate is single payer versus multi-payer healthcare system. What is the right thing to do? And we're going to bring lawmakers. We're going to bring health economists. We're going to bring industry executives, because unless all the stakeholders come together, we will not be able to have crosstalk. We can't really figure out a solution. So if you have a chance, please join us. So these are some of the confirmed faculties. Many of them are nationally renowned, and you will see their names in New York Times and the Washington Post. Our most ambitious project ever. So we are looking at establishing a major cancer center in Nepal. It will be the Comprehensive Cancer Center, and we are hoping that it is going to provide care to almost 20,000 new cancer patients in a year when it is complete. So this is a picture of Nepal, right? So a map of Nepal. So if you look at Nepal has 7 provinces.